Welcome to Surgical Insights with Dr.Deepz. Today I will be discussing about hypocalcemia, a condition that is particularly important for surgeon, intensivist and emergency physician because severe hypoglycemia can cause rapidly life-threatening conditions like tetany, laryngospasm and others. Okay, so let me proceed with the topic. Uh, so in order to go through further, I would like to tell you the definition of hypocalcemia. It is a decreased serum calcium. It is decreased serum calcium, where the normal range between 2.2 to 2.6 millimole per liter. In some textbook, it has been mentioned 2.1 to 2.6 millimole per liter, and ionized calcium is 1.1 to 1.3 millimole per liter. Okay, and before proceeding, let me go to physiology recap. In previous video, I have discussed about physiology of calcium. So let me go through PTH. PTH is something like when there is a low calcium, that is lesser than 2.1 or 2.2. When there is calcium that falls below 2.1 or 2.2, parathyroid hormone is released usually from parathyroid gland, and you can see following in that you can see osteoclastic activity. Let me write it. You can see osteoclastic activity, osteoclastic activity performed by parathyroid hormone, and with the help of osteoclastic activity, bone resorption occurs, and renal reabsorption also occurs, and finally vitamin D activation also occurs. Thus there is an increase in serum calcium. There is an increase with serum calcium, and vitamin D, similar to parathyroid hormone, again you can see plasma plasma phosphate and plasma calcium is major here. Absorption in gut calcium, actually absorption in intestine, this two are absorption in intestine, and reabsorption in kidney. Okay, reabsorption in kidney. Okay, then calcitonin, finally it creates a osteoblastic osteoblastic mechanism that locks the bone, and finally serum calcium is decreased. Okay, this is the recap of physiology. Coming back to causes, causes are very important, and hypocalcemia, one of the major causes, parathyroid hormone level, caused by parathyroid hormone level due to low or inappropriately normal PTH, and post-surgical cause after thyroid or parathyroid removal. Okay, eventually a surgeon performs thyroidectomy, and accidentally he removes parathyroid gland, and finally results as hypocalcemia. Okay, hypocalcemia. Again, next thing, autoimmune APS disease. Okay, APS1, actually APS1 is actually decrease in, let me write it, APS1, decrease in PTH level, and decrease calcium, and increase candida infection. Okay, increase candida infection. You have to know this. Infiltrative hematochromatosis. Hematochromatosis literally means increase iron content in liver. Okay, increase iron content in liver, and post radiation. These are all the things how to know. Okay. And secondary causes high PTH. High PTH due to vitamin D deficiency. As we know, osteomalacia seen in adult. Okay, osteomalacia in adults, And in pediatric case, we can see similarly with rickets, pediatry. Okay. Then chronic kidney disease, and indirectly again it may be due to magnesium deficiency, and it may be also due to vitamin D deficiency that may results into chronic disease. Okay, and we have already there is a cause with magnesium deficiency. There will be a parathyroid hormone resistance with impaired secretion. And okay, next is pseudohypoparathyroidism. Okay, it's pseudohypoparathyroidism. Here the calcium is decreased with increased PTH. Okay, this is the issue. Usually hypoparathyroidism means it has to decrease, but alongside with calcium PTH increases, and target organ resistant actually, and there will be a short fourth and fifth metacarpal seen in the pseudo hypoparathyroidism. You have to know this. Okay, let us go to next slide. Next is causes normal or low parathyroid hormone. We can see acute pancreatitis, saponification, under saponification, rhabdomyolysis. Rhabdomyolysis is early phase of rhabdomyolysis where hypocalcemia occur and calcium deposit can be seen in injured muscle. This is the definition of rhabdomyolysis, and we can see increase in hemoglobin, severe increase in hemoglobin also we can see in rhabdomyolysis. And biphosphanate. Biphosphanate is next cause due to rapid IV infusion and massive transfusion. There will be a citrate salathion. This is like citrate usually binds with calcium. If you do massive transfusion, citrate binds with calcium, and the calcium is decreased here. And next sepsis. Sepsis is definition of sepsis is all the fluid content comes outside the abdominal cavity or peritoneal cavity. Okay, all the in gastric or intestine fluid, gastric or intestinal fluid comes outside peritoneal. Okay, peritoneal compartment. Peritoneal. Okay, lumen. I can lumen. Okay. Next thing, signs and symptoms. Everyone has to know. Hypocalcemia may result into convulsion, generalized focus, and not only hypocalcemia, even hyponatremia may result in convulsion and coma. Okay, arrhythmia is prolonged QT interval. I would like to draw here. This is P wave. Okay, P wave, and Q or S T. Okay, Q or S, and this is T. Okay, this QT interval may prolong actually. QT interval may prolong. I would Q or S T. Okay, QT interval may prolong. I can draw better diagram. A minute. So first P, Q or S T. Okay, so now again P, Q or S T. This is prolonged actually. Okay, QT interval prolonged, and this may further complicate into Torsades de Pointes. Okay, Torsades de Pointes. Torsades de Pointes looks like sawtooth. Okay, like this. Okay, and further there is Chvostek sign. Okay, which is tapial tapping, facial tapping, and Trousseau sign. Trousseau sign is there will be a carpopedal spasm while placing BP cuff. There will be a carpopedal spasm while placing a BP cuff, and spasms consider that there is a laryngospasm, airway obstruction here, that I would be discussing in emergency medicine, and numbness perioral fingertips. Okay, this is the sign. And coming back to other signs is muscle cramp due to tetany and hyperreflexia. Hyperreflexia, you can reflex abnormality, and papilledema can be seen, which is pseudo tumor cerebri, and there will be often associated with confusion, extrapyramidal tract signs here, which is very rare. Okay, coming to facial this thing, Chvostek sign, which is tapping over the facial. Okay, facial nerve just anterior to the ear, and immediately patient begins with contraction. Okay, causes contraction or twitch, contraction, facial muscle twitch. It would be happening of the ipsilateral facial muscle, where the test is performed the same side, ipsilateral. If it is opposite side, the meaning is contralateral, but ipsilateral facial muscle twitching may occur while performing four-step sign. Okay, this is the, it indicates hypocalcemia, low serum calcium. Okay. Okay. Next is Trousseau's sign, not to be get confused with Trousseau's sign and Trousseau's syndrome. And in Trousseau's sign, while placing a BP cuff inflation, we may note the patient will have carpopedal spasm similar to, which may confuse claw hand like appearance, claw hand, which may mimic like claw hand, but it is not claw hand. It is due to hypocalcemia. While placing BP cuff, it may result into carpopedal spasm. Okay, and not to be confused with Trousseau's syndrome, because Trousseau's syndrome is seen in pancreatic cancer, carcinoma, associated with migratory calcium deposit. Migratory calcium deposit in muscle of the leg. Okay, but muscle of the leg. So not to be confused with Trousseau sign and Trousseau syndrome. Okay. Coming back to next, management. Okay, management for severe hypocalcemia, but we have to also note ECG. So as I discussed, P, Q or S, and TT is actually prolonged here. Prolonged QT interval is seen in lead 2. Okay, Torsades de Pointes again is seen in lead 2, and sawtooth appearance. You can see teeth appearance here. Teeth, sawtooth appearance seen in lead 2. All the ECG changes in lead 2. Okay, how to know. And here we have to follow the management protocol, a rule of 10. Rule of 10, 10 ml of calcium chloride or calcium gluconate of 10% solution, and IV slow over 10 minutes. Okay, slow over 10 minutes. Any one of this can be given, and you need to be alert that you should never give calcium chloride or calcium gluconate along with bicarbonate, sodium bicarbonate in the same line. Otherwise, what will happen? The calcium carbonate precipitate in the this thing, at the site of entry of the line, and we can see an occlusion or embolus. Okay, we can see occlusion or embolism. Okay, in the blood vessel. Okay, so you should not give same, at the same line. We should never give calcium gluconate or calcium chloride along with sodium bicarbonate. We should not give in a same line. So opposite line we can do. And other life style we have to do is, we have to improve we have to treat the underlying causes like vitamin D. We have to give calcitriol, and oral calcium can be given 1 to 2 gram elemental calcium per day, and treat the underlying causes like hypoparathyroidism along with vitamin D deficiency. If it is renal failure and sepsis and post surgery, you have to treat and correct. If there is a hypomagnesemia, we have to improve. We have to administer the supplement. Okay, supplement. Okay. Questions here I would be reading and discussing. A 34-year-old lady has just undergone parathyroidectomy, for a primary hyperparathyroidism, and this means they have to remove, actually. They have to remove. Operation is difficult and all four glands were all four glands were explode, and the wound was clean and dry at the conclusion of the procedure. And the suction drain inserted. Okay, and on the ward, she becomes irritable and develop respiratory shredder. Okay, on examination, her neck is soft. Okay, and drain empty. Which of the following treatment should be tried initially? Intravenous calcium gluconate, administration of intravenous calcium gluconate, or if they give another thing, calcium chloride can be also given. Rule of 10 should be followed. Rule of 10. Okay, 10% of C calcium gluconate or calcium chloride, okay, should be given within 10 ml and in 10 minutes, in every 10 minutes. Okay, this is the question. Okay, next question. An elderly lady who presented with weight loss, malabsorption, and was found to have amyloid of the small bowel. Okay, on presentation, she was found to have osteomalacia, and was hypocalcemic. Okay, over the past 7 days, she has received the total parenteral nutrition with adequate calcium replacement. Okay, and despite she remained hypocalcemic. Okay, and deficiency of which of the following electrolyte is most likely to account for this process? Ultimately, for calcium supplement, always magnesium. Okay, this is hypomagnesium, hypomagnesia, hypomagnesia, and hypocalcemia. Both are like husband and wife, always presents. Hypomagnesemia presents with hypocalcemia, always. Both are like husband and wife. Okay. Okay. Next question. 54-year-old man was brought to the emergency department. Okay, emergency department after being found collapsed in the street. Okay. History of alcoholic liver disease, and blood test revealed the following. Calcium is 1.62, which is very low. Albumin, okay, 33 gram per liter. And which of the following is most appropriate management of the calcium result? Again, this is 10 ml of 10% calcium chloride over 10 minutes. Okay, a rule of 10 we have to apply. Okay, the next question. 65-year-old Asian female, present with extracapsular neck of femur fracture. Okay, and investigation shows calcium is 2.07, which is very low, and phosphate is 0.6 millimole, which is also low, and alanine phosphatase 256 international unit, which is very high. So based on the adult age group and calcium, so this is ultimately Osteomalacia is the answer. Osteomalacia is the answer. And in case I would like to change the scenario, I can give you 8-year-old uh, girl or a child. Okay, and here I would like to add on X-ray cupping of bone, cupping or spraying of bone seen in X-ray, or you can. This is suggestive of rickets, but the presentation won't be with ALP this much high in a child, but rickets is the answer. Okay. Uh, Final question. A 48-year-old lady undergoes a redo thyroidectomy. Again, she presented with thyroidectomy, maybe hemithyroidectomy previously, and for a multinodular goiter. 24 hours post-operatively, she develops achelogyric crisis, and diffuse muscle spasm. Most likely diagnosis and appropriate initial management. Ultimately, the answer is hypocalcemic tetany, muscular spasm, hypocalcemic tetany, and administer intravenous calcium. Again, administer intravenous calcium. Hopefully, you enjoyed the session very good, and kindly subscribe my channel and give a like and comment for the doubts or any other queries. And finally, please pause or share the video link to your friends or teachers. Okay, bye. Dasvidanya. Thank you. Okay, bye.